So in this video, I'm going to show you how to open a patient's file, view their medical records, and enter your notes into their records. So the first thing you do is go into the search area here, and you type in the name of the patient. So let's say our patient Katrina Kef, and then you just select that patient and click on Open Records. And here you can see all of Katrina's past medical history. You can see her occupational history. You can see her family history. You can see that she does have significant family history that is all listed here. You can also see her medication allergies. You can also see her smoking status and alcohol intake and any recreational substance use. And you can edit all of this. So for example, if Katrina tells you that her father had a stroke when he was 75, you can put that in here. So you can just write down father stroke at age of 75 years. And at the bottom, you just click on update, and it will save all that information for you. So that's already saved. So that's quite good. Now you can also look at her past medical records. So you can just click on patient records here. And here you can see all of her past medical records that have been entered by other doctors and nurses. You can see that on the 4th of November, she presented with 4-day history of coughing and sore throat. The impression was right low pneumonia, and this was the plan and the treatment. And you can also see the notes from other dates. The 16th of October, she presented with the 4-day history of a headache, and so forth. And you can go down as far as you want to. And over here, you can also filter these notes. So for example, you only want to see the notes from a particular staff member. For example, you only want to see what Dr. Anil Sharma, who's a cardiologist, what he has written in here. So you can just click on that, and you can just click on search. And then you can see that we have filtered down the results to only what Dr. Anil Sharma has written. Now you can also enter your own note. So for example, if you saw her today in your clinic and you want to enter the notes, you just click on enter new note. And this says test doctor because I'm logged in as test doctor, but normally this will have your name on there. And then you just enter your note. So I can just say, I don't know, 3-day history of urinary urgency, frequency, examination, tender in suprapubic area, urine dipstick shows leukocytes, impression UTI, plan antibiotics as prescribed. And once you've entered that, there's no need to save it because it saves it automatically. So it's automatically saving that. So I can go back somewhere else, and I'll come back to patient records. And here you can see, here's the note that you've just entered. You can, of course, add more things. For example, if she's left and you suddenly remember, oh, I've told her to drink fluids, but I've forgotten to write it down, so you can write that down, or you can put here, advised to see me in 2 months. And there you go. That's automatically saved, so we don't need to do that. We don't need to save it. So this is quite good. You can also, of course, tick on whichever entries you want, and you can print it. So if you click on the print button, you can go ahead and print it. You can click on this on export as PDF, and it'll make a PDF document for you. So you can save it. You can attach it to your emails if you're emailing it to your colleagues, or send it in other areas. So those are some of the things you can do in the patient records area. And of course, you can also click on the medications area, and you can look at all of Katrina's medications. You can see the dates of the medications that she's had prescribed to her, the dose, how much she was given, whether it's a long-term medication or not. And you can also prescribe new medications, and this I will cover in the medications video, in more detail. So watch the medications video in more detail for more information on this.